Hello, it's Thursday, May 18th, 2023. It's Dr. Rhonda Johnson, and today I'm talking about excess deaths among Black Americans. Well, researchers at Yale University published an alarming study in the Journal of the American Medical Association on May 16th, 2023. Now, I'm going to summarize some of the key points from the article as it was written. Now, the researchers asked the question, how many excess deaths and years of potential life were lost for the Black population in the United States compared to the white population in the 22 years from 1999 to 2020. Now, their research findings were based upon the Center for Disease Control, the CDC data, which looked at excess deaths and years of potential life lost using death certificate data. Now, here's the really important finding. The Black population had 1.63 million excess deaths, representing more than 80 million years of potential life lost over the 22-year study period. That is really something. And the total number of excess deaths in 2020 among both Black males and females were higher than any other year of the entire study period. And we all know what happened in 2020. The COVID-19 pandemic hit. Now, they also found that differences in the loss of life were prominent among infants, with the Black-white mortality and years of potential life loss ratios greater than 2.3 among those younger than 1 year of age, meaning Black babies died 2.3 times greater, roughly, than white babies under the first year of life. Now, for the non-pandemic years, heart disease in both males and females and cancer in Black males were the largest drivers of the differences in excess deaths in the non-pandemic years. So let me summarize. I know it's a lot of information. Over the 22-year period from 1999 to 2020, the U.S. Black population experienced an estimated 1.63 million excess deaths and much greater losses in years of potential life loss. Now, the terms years of potential life loss are difficult to explain in the context of a short video, but in simplistic terms, it's a measure of premature mortality. Years of life loss takes into account the age at which deaths occur, giving greater weight to deaths at a younger age and lower weight to deaths at an older age. And again, the study authors estimate the Black population losses in years of potential life represents more than 80 million years of potential life lost over the 22-year study period. Now, the authors concluded that, broadly speaking, these findings indicate that current efforts to curb or eliminate mortality disparities in U.S. Blacks have been minimally effective, and progress when made has been fragile. Now, here's where I go off script and give my opinion. I'm going to simplify these findings. Basically, what this study shows that Black people in the United States are dying excessively, and they're dying too young. Folks, if you die in infancy, or if you die before you have children, you obviously lose your potential to procreate. And if your population does not reproduce itself to the point where more people live than die, your population is going to become smaller over time. Now, back to the article. The authors, these researchers at Yale, said this is a call to action, for millions more lives and life years are at stake, and new strategies are needed. And I couldn't agree with the authors more. Now, awareness is the first step to creating solutions. Now, I realize some people aren't going to believe the CDC data, but I can tell you as a public health professional that death certificates do not lie. The only way to earn a death certificate is to have died, folks. So I'm asking you to please share this video with your friends and family and comment if you have thoughts about new strategies or possible solutions. Thank you very much. Take care and be well.